And welcome into To Your Health. You know, it's my 10-year anniversary. 10 years ago, I had 6 bypasses on my heart. And when it happened, so many people would call me and say, "Oh my gosh, I heard you had a heart attack." Well, you know what? I didn't have a heart attack because my heart's pretty healthy, but people think that when something happens internally with your heart, it's automatically a heart attack. Our guest is Dr. Paul Moore, and you are a cardiologist. You've been on the show before, and of course you were with us last week, and we were explaining how the heart ages, but just I was mentioning on the opening here, Dr. Moore, that a lot of people say, "Well, Jack, you had a heart attack." Actually, I think my heart was pretty healthy, but it was the arteries, the blood supply that was giving me the problems that I had. But so many people have things happen to them internally with the heart as well as the arteries. Explain the different things and symptoms so that we can let our viewers know if something's happening. First of all, they don't need to fool around with it, do they?
No, they don't.
No.
And it can be very, very subtle. When we discuss symptoms in the office with our patients, a lot of times we ask about chest pain. And a lot of people have this conception that when you have blockages in the arteries, you have to have excruciating chest pain. The truth is that most patients don't have excruciating chest pain. If you're having a heart attack, there's usually chest pain with it, or back pain, or neck pain. But most people who have blockages in the arteries, which is what you had, have more subtle symptoms. In men, at least, and women are a little different story. In men, about a third of the time when they have blockages, they have typical angina. Angina is a syndrome of chest discomfort, not chest pain. Many of my patients would argue if I called it chest pain, but chest tightness or pressure or burning sensation, usually when you exert yourself. And it's usually across the what we call precordium, and it is usually with exertion, sometimes with emotional stress. And those are the typical precipitating factors for angina. I say that's a third of the time in men. And about a third of the time the symptoms are much more subtle, much more vague, such as shortness of breath when you exert yourself or unusual fatigue. And those are both common manifestations of coronary disease as well. And then about a third of the time, men who have important blockages don't have any symptoms at all. So unfortunately, a third of the time, the first manifestation of coronary disease is sudden death.
Oh my goodness.
And that's not a good way to find out you've got it. Unfortunately, women are even less likely to have typical anginal symptoms. And so the symptoms that women have include, if they're going to have discomfort, it's more frequently in their neck. They may have fatigue is a very common manifestation. Shortness of breath with exertion, another common manifestation for women. I mentioned the neck discomfort, dizziness for women. Now, a lot of people have dizziness. That's not a very specific symptom, but this comes out of a study that was done by the National Institutes of Health several years ago called the WISE study. WISE is an acronym, stands for Women's Ischemic Syndrome something. But women are different, and women have to have a little higher threshold or a little higher sensitivity for those possible subtle symptoms. Physicians also have to have a little higher sensitivity for those subtle symptoms with women. So physicians have to be a little bit more on their toes when they're dealing with...
You have to probe a little bit more.
Yeah, exactly, other manifestations of heart disease would include profound fatigue. If you're having congestive heart failure, then you might even have shortness of breath when you lie down flat. Sometimes heart racing or palpitations occurs and is a symptom. Now those are symptoms of all sorts of different conditions as far as the heart is concerned. But most people, if they're going to have heart trouble, have blockages in the arteries. That's what most Americans die from, is cardiovascular disease, either heart attacks or strokes. And so it's a very, very common condition. So people who have blockages and have different symptoms perhaps than those who have valvular heart disease.
And when you use the term congestive, that means that something's building up in there, isn't it?
That's an old term, and it really encompasses a huge variety of different conditions. So congestive heart failure is an old term, and it's based on a lot of different symptoms. And but basically, if you have congestive heart failure, you usually have some congestion in the lungs, and you get short of breath as a result of that congestion.
Build up of both together.
Correct.
And then when we talk about coronary disease, I mean, so it's a disease, but sometimes you think of a disease, well, can I cure that disease? Is that disease curable?
Well, it's very treatable.
Okay.
It is treatable. Is it curable?
But I always will have it then, right?
You will always have
Right.
it. You've
Okay.
had yours bypassed,
Right.
but you will always have that blockage.
And always have the blockage and always have that disease.
Yeah. And with bypass, you create a channel around where
the
the
area.
vessel is blocked. But yes, it is very important, and I'm sure we'll talk about it in a later segment.
We are.
To prevent the disease in the first place.
Absolutely.
Because once you have it, it's kind of
there.
Yeah, it's there.
It's there. Okay, well, thank you. And just remember this, as Dr. Moore said, that as your heart is getting a little bit older, sometimes there can be signs. If you have some signs or symptoms that something's wrong, don't take it for granted. Get help right away. And we'll be right back right after this.